So today I'm pleased to speak to you about how the proposed amendments to Bill 17, the Mental Health Amendment Act, will help us further that work in expansion of mental health and addiction services in the province. Bill 17's proposed amendments to the Mental Health Act take important steps to strengthen the protection of patients' rights and improve the efficiency in the mental health care system. They also address a 2019 Court of Queen's Bench decision here in Alberta that found sections of the Act unconstitutional or incomplete. The Act allows for individuals with serious mental health disorders to be involuntarily detained in a facility for treatment or to receive mandatory treatment in the community. The Court's decision found that the Act needs to better protect patient rights, help reintegrate patients back into their communities, and ensure that they're aware of their legal, their right to legal representation and to have access to it. Protecting patients' rights is our first priority. These proposed changes would address the court case by ensuring that no one is detained under this legislation if that step is not necessary or beneficial. By changing the definition of mental disorder, an individual with a brain injury, for example, could not be detained under the Act. However, if the individual has both a brain injury and a mental health disorder, the individual would benefit from the mental health care and could be detained. Now, we're seeking to improve the information that health professionals would be required to provide for patients who have been detained, as well as their families. These individuals should not be kept in the dark at such a critical time. Additional amendments would modernize the Act and reduce red tape. For instance, nurse practitioners would be authorized to complete some forms and certificates and to supervise patients under a community treatment order, easing the burden on physicians in the province. We would also enable the use of video conferencing for a patient's first assessment. This use of technology is long overdue in the year 2020, and these proposed amendments are not only necessary to address the 2019 court decision, they're necessary to safeguard the rights of patients and make our mental health system more responsive and more accessible. Patient care would be more timely and patient-focused and enable families to support and care for their loved ones in a more significant way. Our government will continue to take bold action to improve mental health and addiction care in our province, to ensure patients' rights are protected, and to help more Albertans get on the path to health and wellness and long-term recovery. Thank you. Happy to take questions, Steve.
Yeah, operator, have we got reporters on the line to ask questions?
Yes, we do. Well, the first question is from Kevin Nimick of CTV. Kevin, your line is open. Please go ahead.
Hi, Minister. I'm just going to change the topic here a little bit, if you don't mind. I do have two questions for you. The first one, several Calgarians have expressed concerns that they can't visit loved ones in hospitals or attend funerals, but large rallies and...
Oh, Kevin, you got cut off there.
Oh, looks like Kevin has disconnected himself. I will move to the next question. Lisa Johnson, Post Media.
Good morning, Minister. Thanks for taking my question. I'm wondering if you can speak a little bit to, I understand these amendments are necessary to address the court decision, but the government is still fighting that court decision. What about that decision? Can you explain in your words what the government opposes about that, what fits into the government's mandate, and what doesn't?
Sure. So the 2019 decision is being appealed because the decision of the court made the determination that the act was unconstitutional or contravened charter rights. So that's a position we don't agree with. So we are appealing it on that ground. But look, we're not making these amendments because we're reluctant or being forced to do them. We're making these amendments because of the right thing to do. And this is the right thing to do for patients and their families. And so regardless of what the disposition of the court would be and whatever the appeal decision ends up being, generally we're committed to these principles that are in the Act. How might the Act be different depending on what the decision of the court is? I can't say at this time, not until I see a decision of the Court of Appeal. But I can say this: the principles that are in this act, we generally agree with. They're the right thing to do, and we're committed to these changes. And we'll wait and see to whatever the court's decision ends up being and how that might change the act going forward at that time. Thank you, Lisa.
Yeah, thanks, Lisa. Next question, please.
Thank you. Yes. To follow up, we have Kevin Nimick back on the line. Kevin, your line is open. Please go ahead.
All right, we'll try this again, Minister.
Sure, Kevin.
So I do have two questions. Here's the first one. Several Calgarians have expressed concerns they can't visit loved ones in hospital or attend funerals, but large rallies and protests are still occurring across the province on an almost daily basis. What are you doing to address this perceived double standard?
Well, look, Kevin, I would say this, that the Chief Medical Officer of Health's orders and the guidance are first trying to make sure that we're taking steps, taking the perspective of an infection prevention and control perspective in our health facilities, including hospitals and long-term care, to make sure that we're doing everything we can to protect the patients and the residents in those facilities. And look, if there are folks who are not complying with one of the orders or the guidance of the Chief Medical Officer of Health, then this government is going to be investigating ways to look at enforcement. So maybe I can't, because I think your examples were pretty generalized and vague. I'm not sure of any specific examples that you're talking about, but look, if sorry?
So maybe if I can interject,
Sure.
Specifically if we're looking at, let's say, Black Lives Matter protests that happened yesterday and on Monday. These are groups of, let's say, 2,000 people who are, within 2 meters. So why can that happen and other sorts of events or gatherings can't happen?
Well, right now, the decision of the Chief Medical Officer of Health, from my memory, is that outdoor recreation is limited at 500. Folks must still be complying with the guidance of the Chief Medical Officer of Health. So protests would be an outdoor activity, and I would recommend anybody who's considering to protest to continue to make sure that their voices are heard in a constructive way, but also in a way that is not going to put themselves, their families, and their loved ones at risk, and making sure that they can do it in a way that's still complying with the Chief Medical Officer of Health's orders and guidance. I think there's absolutely a way that we can make sure that we as citizens have our voices heard, and folks that want to be able to express those opinions can do that, but following the guidance of the Chief Medical Officer of Health.
Thanks, Kevin. Next question, please.
Thank you. The next question is from Lydia Neufeld of CBC Edmonton.
Hi, Minister. My question is, getting back to the bill, what do you see as the most significant of these amendments and why?
Well, I think there's a number of very significant amendments. I think what we're trying to do is make access, especially to the assessment part. So first, when somebody is determined to be in need of help, there has to be an assessment, and whether there's a mental disorder. And to date, a lot of these assessments have to be done at a designated facility, and some of those facilities aren't easy to get to for folks who are in rural Alberta. So allowing for more designations of community locations that could be closer to the patient, I think are an added benefit. Allowing nurse practitioners to also be able to do those assessments, to bring a lot of these processes into the 21st century by allowing video conferencing technology, I think are some of the great initiatives that are included in this bill. But happy if you have a specific part of the bill that you would want me to comment on specifically, happy to address it.
All right, thanks, Lydia. I think there are no more questions waiting on the line, so I'll thank Minister Shandro. Thank you to reporters who called in. As always, if anyone has follow-up questions, please contact me as usual. So thanks all.